Dealing with recurrent pregnancy loss can be incredibly frustrating, especially when there's no answers that can be found on why the pregnancy losses are occurring. So we've always talked about the importance of the gut microbiome, the reproductive microbiome, for a variety of health issues. We've touched on how the gut microbiome may have a crucial role in supporting management of symptoms of things like polycystic ovarian syndrome. It may have a role in severity of symptoms or conditions like endometriosis. And a newly published trial found a link between risk factors of miscarriage and the gut microbiome as well. So there's a very common health condition that we hear about often called leaky gut. Basically, there's an impairment in the intestinal barrier integrity. And so we see increased absorption of things that we shouldn't be absorbing very efficiently. And so we see there's higher absorption of heavy metals, particularly lead, for example. And there can be increased absorption of things like bacterial endotoxins produced by pathogenic bacteria in the gut microbiome. So the study looked at patients that had recurrent pregnancy loss, and they found that with a treatment of prebiotics. So prebiotics are food for healthy, beneficial gut microbes, and they found that using this prebiotic formula was actually able to reduce those risk factors. So compared to the control group, using prebiotics was actually shown after about a 2-month treatment period to reduce levels of heavy metals like lead in the blood, and they also saw a reduction in the concentration or presence of bacterial endotoxins as well. So they found that using a prebiotic formula was actually able to improve intestinal integrity, intestinal barrier integrity. Now, it's very important to mention that this study did fall short of actually checking for changes in the risk of another miscarriage. So it's just looking at these risk factors that have been established as potent risk factors for a loss, exposure to heavy metals like lead in higher than acceptable limits, and exposure or increased absorption of things like bacterial endotoxins are both potential risk factors for recurrent pregnancy loss. So now we're starting to see this trend where the gut microbiome may have a pivotal role or a crucial role in supporting patients to not just get pregnant, but potentially to carry to term with a healthy pregnancy. So we still need a lot of research to help, like mentioned earlier, observe if taking prebiotics in patients who do have leaky gut, as a common name we refer to that condition, may be beneficial not in just reducing the levels of those heavy metals or bacterial endotoxins, but whether that actually translates into a reduction in the risk for another loss as well. But considering the high safety profile, considering the benefits that prebiotics have been established to exert on a variety of conditions like we mentioned earlier, like PCOS, potentially endometriosis as well, it is worthwhile having a discussion with your healthcare provider on how including certain prebiotic soluble fibers may be beneficial for your case, and discussing any risks and benefits for your particular case.